Okay, sorry for the interruption of the video there. I thought I was getting a call in from work. I'm on call today, so... Anyway, take a look at my airway equipment here. This is what we call a laryngoscope, and it's what we use to intubate the airway. I'll show you how to put it together here in a second. Let's put the camera down. So it fits in just like that, and then this bulb on the end, I don't have any batteries in here right this second. This bulb on the end lights up, and we can see the inside of the airway in the patient and clearly see the trachea and that sort of thing. So what you do, if you were looking from my viewpoint, I guess you could say, and you had the patient's head right here, tilt back the patient's head, insert into a sweeping motion into the mouth, and you would push forward, be able to visualize right through the vocal cords there and pass your ET tube in, and then you have a patient airway. Pretty cool stuff. So that's some of my airway stuff. Don't have an ET tube that I can show you. I wish I did. Maybe we'll show you in a later video. So all my IV supplies right here. Start an IV. Again, we got the lidocaine over here for any nerve blocks. I even have some chromatic gut in here. This is actually, it's a suture cap. So this is what we call stitches that are in here. If you open this up, there's a needle and suture in here. And to treat chest pain, I have nitro. And we also have some aspirin in there. Over here, we got just hand wipes and that sort of thing. Regular old flashlight. It's always helpful sometimes. And this is just some lubricating jelly for the ET tube when I'm doing airway work. Okay, come over to the side pouch here. Got a Dynamed CPR mask. More eye protection, it's easier to get to. I have to do some CPR there. Quick shave razor if I need to shave the chest for an AED or to shock a patient. This is a glass breaker, similar to the one I had in my bag. It's more like a hammer though, so you can hit the glass and break it out. It works nice. There's also a seatbelt cutter right here too. Just some miscellaneous stuff. Now over on this side, I got mostly trauma dressings. So I got a big abdominal trauma dressing, some 0.9 sodium chloride irrigation fluid, some Curlex, and some ace bandages too. And another suture removal kit. These little guys are great. They're irrigation caps. You can pop it right on top of these bottles and irrigate wounds. So really good stuff. All in all, I'm looking to get a new bag, looking into a bigger bag so I can carry more equipment and more ALS supplies. Also looking into getting possibly a older version of the Life Pack 10, or even a Life Pack 12. And we'll go from there. So working on building my equipment, working on building my loadout. Any suggestions would be great.